All right, well, let's try this again. All right, I'm going to try this again and let's just see if anyone can connect. Uh, okay, I think I'm back on. I know they said that I talking about my mom. Also, don't forget if you guys had or have questions, ask them. Just cut me off. I was just kind of giving you guys a little insight into my life. Okay, I think the people that were on are back on. Well, anyway, all right. So I think I got cut off where the last person commented that my mom had lost her job in 2008. They let my dad retire. My mom didn't, and it devastated her. And as a female working in the industry and had a solid job for 27 years, it just crushed her. So she already instilled in me like back then, like do something that you love, do something that you're passionate about, something that you're really great at, that you're going to strive for. And I was like, okay, this is calling towards me and this is the way I'm going to go. So, when that was when physical therapy also, like, again, the insurance companies were covering for clients. The insurance companies were taking care of patients. And it was great because you could be one-on-one with them, right? You could take the time as a physical therapist to be with the patient. You weren't just spending 10 minutes in an eval and then sending them off to people that are in, PTAs, which there's nothing wrong with that, or, aides that are working in the clinic that might not necessarily know proper technique. And then you're not really following through or following C with clients. So as the years went on and I was in and out working as an aide for many, many people, I worked for some amazing physical therapists and I worked for some really crappy physical therapists, but I learned so much. I was like a sponge. So I took everything. And if you watch me practice or if you ever experience a session with me, I'm very much like I'm pulling from all different types of places. And some of my students, when they've come in and observed with me, they're like, how do you just switch? Like, you can switch from a 9-year-old client to a 3-year-old baby to an MMA fighter to an NFL football player. And it's just I say to me myself that it's really the years of experience that I've had meeting with multiple different people, working with multiple different people, learning different attitudes, energy levels, vibing off of the way the client comes in and really getting to know the patient first and foremost before actually using my knowledge base to then kind of help them through whatever injury they're coming in for. And so that's what, again, there was another factor that kind of motivated me to like, hey, start my own practice. If I was going to spend all this money and all this time dedicating from the age of 16 to late into my 20s to do this, you bet your ass I was going to be happy doing it. And you bet your ass I was going to make sure that I was on top. And if not, I was the best of the best in doing it. And there is so many years and so many things I still have left to learn, but I am definitely trying my best every year to just grow a little bit more and a little bit more and, find new scientific techniques that are coming out, learn more in the industry, especially in sports and conditioning, strength and conditioning, how to provide, the best of the best for my clients. So that's a little bit about me. If you guys have any questions, again, please feel free. If I said anything that you guys have any comments on, write them in the chat. I just want to keep it going for just a couple more minutes. But like I said, I'm going to get into the routine of doing this more on Sundays, maybe every other Sunday, however many people come in and join, and try and get back to some of the questions that some of these people have. I did get a question off of Instagram. So let me pull that up. And she said, was it really hard? starting your own practice. And I said, it's a catch 22 because like I said, everyone is different. Where you came from is different. Did I come from money? No. I didn't take out a loan. I worked 7 days a week, 14-hour days to just try and make it and do the best that I can. I didn't do Google ads. I didn't, I used Instagram, but I didn't have a massive following. So, a lot of things that I did was to just try and get to the position I'm in today. And that took a few years. I would say probably 3 or 4 years of me grinding and grinding and grinding before I got to this point where I was like, okay, I feel like I'm running on all 4 cylinders and I have a great schedule and I'm busy. And honestly, it wasn't until this past year that I got an assistant just to help me with clerical stuff because I was in over my head with stuff, especially when I started with football last year because football was a little crazy. Arthritis in your thumb. What techniques can I use to get some of the movement back? I'm assuming this is in your saddle joint, which is this part here. And that is tough because it is a very, very vulnerable and you use it a lot to oppose. And depending on how much of the movement you have left or what you have left to use, I would start with just doing gentle traction. And then I can show you some ways to start moving it. And then anything you can think of, like thumb expansion. I wonder if I can get links. Maybe I can drop some links in this thing on Amazon. Um, anything that you can do to work on your grip strength and obviously the small little muscles, which would help a lot. But tractioning, as I looked this up, tractioning is like you have the joint here, right? And I'm pulling this way. I'm pulling away. I'm just trying to distract that joint a little bit. And then you can start moving it. So you don't want to go from the tip here because you're not going to get that saddle joint. But if I'm here, let me see this way. I'm trying to get this joint to move. So I'm going to pull away from it. You can actually see my tissue move. And then I can go in different directions. So I'm going forward, back. I'm going up, down. And then you want to oppose it. So you want to, opposing is going to the pinky. So you're going to go this way. And you can kind of play with that up, down. And again, you want to get it from this joint. Don't pull from the tip here because you're going to get the IP joint and we don't need that. So if you're here and you can kind of move it around, you can start, you probably are going to get some stuff like that. You'll probably get some things moving around in there. I actually have a video on my YouTube. And again, I'm going to have to figure out how to share things on here. But therapy. And then I'll have to find the video. But it is on my YouTube. I'm making like a meatball with it. I'm squishing it. Anything that you can do to get all the dexterity in your hands going. I think this is therapy. Yeah, let me send this link and then I'm going to answer some of the other questions that just came through. I mean, you can go on Amazon and look at a couple of them. And then there's finger spreaders too. And again, I have all these on my YouTube. So let me go into this, see if I can respond back. Nope. All right, I'm going to get better at this because maybe when I end the stream, I can send the links for all these things because it looks like I can't. Cortisone injection for frozen shoulder seems hit or miss. What state are you in with your frozen shoulder is my question. Because if you're straight up in the beginning of it, which sucks, and I'm so sorry for that, it can help in the fact that it's not going to probably help the motion of your shoulder, especially if it's in the very, very first stage and it's frozen. But it will, it's in the thawing stage. I don't know. I mean, I think that it's not really worth it unless you're in a crap ton of pain still. If you're in the thawing stage, I would just buckle down and keep moving that thing and strengthening your scapular muscles and go with it. Because honestly, I just don't think if it's in the beginning when it's like super painful and you can't sleep and you can't lay on it and gnawing every night, I think it is worth to get the cortisone injection at that point. But in the thawing stage, I just don't think if you're already getting movement out of it and it's not bothering you every day and you feel like you need to swallow, ibuprofen, then I just wouldn't do it. And I'm probably just a couple more questions if you guys have. just because I'm going to go make dinner for the dog and my husband. Husband first, obviously. But like I said, if you guys are enjoying this, then I'll get on doing this more often, every Sunday or every other Sunday, just so you guys can ask more questions. Or if you guys think of things, I'll put a poll up, and then you guys can put some questions there, and then I'll make sure I have questions to answer that you guys can always go back to and watch the whole video if you can't get on at the time that I'm doing it. I know it's late tonight too. All right. Well, if that's it, I will try and get those links on there. Okay, wait, one more. Bicep tendonitis flares up my shoulder sometimes, not able to lift. Any advice or what to do daily? So the thing is if bicep tendonitis is it's hard because sometimes if people have pain in the front of their shoulder, they believe that that's bicep tendonitis. If you truly got diagnosed with bicep tendonitis, then that's a whole nother story. But usually why that occurs is because of your shoulder blade positioning. So if you're noticing that there's a winging of your shoulder blade and you're kind of rolled forward on that side, or maybe you have an acromion process where your AC joint is kind of like protruding a little bit more, what I would work on is more scapular stability exercises, not so much the rotator cuff. Because if you can get this shoulder blade, so strengthening low trap and serratus, so if you can get that to kind of roll back into a better position, you're going to take the strain off the front of the shoulder. So even if it's biceps or it's, inflammation underneath the AC joint or bursitis or anything like that, you can then start taking that stuff off. And like I said, if you guys kind of go through my YouTube videos, you're going to find a lot of good stuff on there. I will be better at making playlists so you guys can kind of check in and go there. Will a slip disc cause seizures? It's a really good question, but usually if it's just a slip disc, not necessarily. Now, if this was a disc that was very extreme, traumatic, pushing on your spinal cord and creating like spinal cord leakage, then possibly, yes, it could do that, but not, it's usually not. I mean, most of us walk around with slip discs, so I don't really think that will do that. I'm sorry, I'm nasally. I got through a cold last week. But yes, I would not say that just having a slip disc randomly would actually cause you to have a seizure, unless you also have possibly, a genetic predisposition or something else is going on inside your brain. But if you are getting seizures, I would highly suggest going to a neuro specialist because that's not great either. All right, I'm going to go in 2 minutes. So if you guys have any more questions, I don't know. Is the emojis because you've had seizures, or they're telling you your slip disc has caused a seizure? Was someone telling you that the slip disc could have caused that? I don't know. It's an odd thing for the past 10 years and no direct reason. Yeah, I don't think that could be a reason why. And I'm assuming you've had CT scans and all the whole things. I just wonder if there's something else that's causing that. I just haven't seen it, so I'm not really sure what that would be. But if you can give me more information and send it my way, I'll also put my email down in the link when I finish the video. And maybe we can meet up on an online chat or online appointment at some point, and I can kind of deduce that, because that just sounds so bizarre and so out of whack. And I'm sorry you're going through that. That's terrible. All right. Well, I'm going to get going. I'm going to try and do this again. If you guys like the half hour, you guys like an hour, just I'll put a poll out in the next couple of days to just see what you guys like. And if you guys have more things you want me to answer or work on, then I will definitely work on that. But thanks for coming. This was fun. I like doing this. So I'm definitely going to do this again. All right. Love you guys. Happy Sunday.